the face of HIV being our future. If we contextualize it in that manner, maybe the message will land that this is why we are working so hard, because we know that the future of this country, the future of this region, the future of Africa is riddled with this epidemic.
Yeah.
And in particular, it is a young adolescent Black girl from the ages of 15 to 24. That is where epidemic is sitting. That's the future. And this is why we cannot rest and we cannot relax, because until today, we are still grappling with closing the tab on new HIV infections in the region, in Africa, in the world. But we care a whole lot that that picture changes for the sub-Sahara region, so that it can change for Africa, so that it can change for the world.
Yeah. Hello, everyone, and welcome back to another episode of the Root of the Science podcast with your girl, Anne with an E. If you are new here, welcome to the show. It's always so lovely having new listeners here. If you are a regular, thank you so much for tuning in. Also, just want to take the time to say thank you for the people who leave comments on episode, who comment and share. We really, really, really appreciate that. Now, let's get into today's episode. This episode will focus on the important and evolving landscape of sexual and reproductive health of young women. We'll explore the latest interventions that are making a difference in their lives. The aim of this episode is to provide you, as our listeners, with an understanding of the challenges that young women face in accessing sexual health services and some of the innovative solutions that are being implemented to overcome this barrier. The discussion will highlight the medical and technological advancements and the social-cultural dynamics that influence sexual health practices as well as policies. I'm so happy to be joined by Tabita Ntuli for this discussion. She is a seasoned expert in global health and public health advocacy and community development. She has spent decades as a significant contributor to the UN Joint Program on AIDS, otherwise known as UNAIDS, which is a global agenda towards ending AIDS as a public health threat focused on South Africa, and she's primarily based in Pretoria's country office. Her current role at UNAIDS is Equality and Rights for All advisor, and is complemented by pivotal roles at the international frontrunners like UNICEF, the Medical Research Council, Aurum Health Research Institute, and public health and civil servant in the South African government. I am so grateful to have her on the show, and tune in to listen to our rich discussion. Let's go. Good morning, Tabita. Welcome to the show.
Hi, Annie. Thank you for having me. I appreciate this moment, and good morning, good afternoon, good evening to everyone that's listening or watching wherever they are in the world.
Lovely. We are so grateful to have you here. So you are the advisor for equity and rights for all at UNAIDS. Could you kindly explain your role for our listeners so that we can get some context on why we have you here today?
Okay, thank you. Thank you again. So I am the Equality and Rights for All advisor at the UNAIDS country office in South Africa. UNAIDS, for those that may not know, is a joint program on HIV and AIDS. It is it's a program within the UN. We coordinate the work of the co-sponsors, and the co-sponsors would be UN entities like WHO, UNICEF, UNFPA, UNESCO, ILO, IOM, UNDP, UN Women. And so I've just given you a flavor. So we coordinate the work of the co-sponsors on the AIDS response. That's what we do. And my role in the country office is Equality and Rights for All advisor. I work on, my portfolio includes gender work with young people, work with people living with HIV, work with the South African National AIDS Council, civil society and government in the AIDS response work of the country. And on my portfolio also, I take care, part of my responsibilities include human rights work, SRHR, a subject that we will be discussing today.
Yes.
And I always forget one, and I shouldn't. So it's human rights, it's gender, it's young people, it's people living with HIV. Yes, and work that is related to HIV and cause and civil society.
That's a very extensive portfolio that you look at. But I just wanted maybe, since we are going to be talking about sexual and reproductive health, I'd like maybe to ask you on a more personal aspect, what inspired you specifically to maybe work in this division that you actually are part of in your portfolio?
Because naturally I care about communities. So even before I joined the UN over 10 years ago, I was always found in the spaces of communities, and secondly in the spaces of HIV and the AIDS response of South Africa in particular. So I care about impact. I've seen how HIV, I'm trying to find the correct English word, how it destabilized and traumatized and hurt us as a people. Because I've supported South Africa right from the beginning, from when we did not have ARVs as a country to when we started rolling out ARV medication as far back as 2004. The first province to do this was the Gauteng province, and I was in the clinical mobile support team, and I had the privilege of seeing what HIV, how it touches people's lives at a community level. So I come with that blueprint of caring and really focused on impact and being consistent in our interventions to change the lives of our people for better. And I have a very soft spot for young people. The young people are the future of now. Young people will personally look after me in my twilight years by policy and ensure that I want to ensure that young people ensure for me and my generation that we live in decent conditions, our healthcare is okay, the policies are decent and humane and applicable and futuristic and care about, and they are all embedded with the human rights and with the human being in mind. So I have that vested interest because I know I'm not going to have this honor of serving the world in the manner that I do forever. Even though I consider myself a lifetime activist, I think I'll be 90 and be, shooting my fist in the air and calling on governments to do right by communities. But I also am cognizant that the world of work has a time frame. And in the time that I leave the world of work, I have done the best within my ability to change or create a blueprint or footprint for young ones to learn on and lean in as they take us in the future moving forward. So that's what inspires me. And in the AIDS movement work, we learned very early to speak facts and data. And on the subject today, around SRHR and young women, what motivates me and what inspires me is the fact that we have data that has proven to us that if we keep our young girls in school until they matriculate, we will reduce their chances of acquiring HIV by 50%. And HIV within the context of the subject, of course, which is SRHR. And I always say SRHR very slowly because acronyms take long to land in my head. So I have to say it.
I also have to think about that one. No, that was such a lovely motivation, and what a beautiful picture of why you started that. And I just want us to maybe start focusing on what you rightfully said, that you've been a part of the HIV campaign, particularly in South Africa, since 2004, and that's over 20 years. No, we are 20 years, over 20 years, yeah, doing that. And I just wanted maybe to speak because I was reading with the fact, like you rightfully said, that Africa as a continent, has a high burden of HIV globally. And it's been said that in 2021, for example, here in South Africa, it was estimated that 8.2 million people are still living with this virus, HIV. And I wanted us maybe to start talking. What are some examples of interventions and educational programs that have been successful in improving these sexual health outcomes? Because we've come such a long way, but why is this still such an issue right now?
Yes, it is. It is. I grapple with that question as well, and because remember, having worked in the AIDS space for as long as I have, naturally tells you that I'm approaching my 50s, and I have done this work long before all my three children were born, and my first child is 18 years old.
Wow.
And the analogy I give is that, when you personalize it, because personal is political and it is what drives us to do the work that we do, is that if my son is 18, turning 19, which means he was born in 2005, and therefore a year later than I had, if I were to give you an example or create a real story. It's not a fiction story, a real story of a young professional, that is Tabita, meeting a woman living with HIV that is pregnant in 2004, right? And as a young professional and grappling with ARVs and its side effects and the politics and community education, which was very overwhelming back in the day, with medical practitioners in the force that had not been preview on HIV education in their school curriculum at university. So you meet this young professional, that is Tabita, who is running a support group session at Johannesburg General Hospital. And a young mother walks in, highly pregnant. It is 2004, and she is here to receive her HIV medication, because we ran support groups in the health setting. And she comes in while she's waiting for her medicines as they are being prepared by the pharmacist. She comes to join a support group, and she's pregnant. Now, two things come into mind as the facilitator of the support group, that is myself. One, Mama is pregnant, and we are grateful that she is taking her ARVs, and she is a new patient on ARVs because South Africa is rolling out in 2004. So we all don't have experience on how these ARVs are going to respond in her body, but so far she's doing great.
Yeah.
Now, we already are worried about another factor, that she's carrying a human life, and we want to ensure that this baby is born HIV free, right? And luckily, Mama agrees to be on PMTCT, which is what we called it back then, PMTCT, and we put Mama on a program that would ensure that she does not transmit the virus to her baby, which is by means of education first, because that is always important, has always been important. We capacitate her with education on the treatment itself. We capacitate her on the treatment she will take just before she has the baby. And we capacitate her on the treatment that the baby will have to take once they are born, to ensure that they are HIV free.
Yeah.
Successfully, we do this, and the child is born in 2004 or 2005. Let's say he's born in 2005, because my son was born in 2005, and they grow up. And I'm still a healthcare professional in this sector, and 19 years later or 18 years later, this very child that we had all hands on deck and worked very hard to ensure that they are born HIV free, acquires HIV. comes to the clinic one fateful day, has an HIV test because they're curious, and they test HIV positive.
Sure.
Something a young Tabita would not have projected, because back then Tabita is working very hard, providing psychosocial support with all the other healthcare professionals and development partners and NGOs. Mama has a myriad of support who looks after her in terms of her journey on HIV medication, ARVs. And today, this child that we worked so hard tests HIV positive. So because we are faced with that very harsh, very sad, very paining reality, we have had programs along the road and continue to have programs that seek to educate and support government interventions on the AIDS agenda, HIV, if you wanna, HIV AIDS agenda. So we have had and continue to have global programs. Now coming to answering your question, global programs, sometimes country programs, customized interventions, because each country is different. And you know why, Anne? Because the face of HIV is Black and a young girl. The face of HIV in the sub-Sahara, if you zoom in, looking at the numbers, the sub-Sahara, if anything changes in sub-Sahara, it will change the trajectory of HIV, of AIDS entirely in the whole globe. But if anything changes for greater, for good in South Africa, in the sub-Sahara, it will change the numbers for the whole world. Because in sub-Sahara, we have the face of HIV being our future. If we contextualize it in that manner, maybe the message will land that this is why we are working so hard, because we know that the future of this country, the future of this region, the future of Africa is riddled with this epidemic.
Yeah.
And in particular, it is a young, adolescent Black girl. From the ages of 15 to 24. That is where epidemic is sitting. That's the future. And this is why we cannot rest and we cannot relax, because until today, we are still grappling with closing the tab on new HIV infections in the region, in Africa, in the world. But we care a whole lot that that picture changes for the sub-Sahara region, so that it can change for Africa, so that it can change for the world.
Yeah. That's such a vivid image. And I love the story that you painted using your son. And maybe before we get to this vivid image of the young girl, I want us to then talk about this hypothetical son who comes back 20 years later, once, even though they were given the support with all these programs. And you rightfully say that it's different with depending country to country. My question is, should the way that we approach educational programs, should they change? Are they still being effective? We live in a very digital age now. Is this something that's being implemented so this young 19-year-old who's consistently on their phone, using technology, maybe they need to come in there? Are those some of the reasons, the ways? So how can we change? How can we break that so that this person is aware and understands the severity? Because I almost think, I don't want to say we want to fearmonger people, but I don't think, people, there's that level of like urgency, especially in young people, to understand about the burden of pressure that HIV has. So I just wanted to check what are some of the interventions and how we can maybe effectively manage this in this digital era as well.
Yes, and history is always the best teacher. Experience is always the best teacher in my world, because communication is very key, very important, and it will never lose its importance for as long as we are riddled with epidemics such as HIV and gender-based violence and human rights violations and inequalities. So education is very important. The how, which is the question you asked me, of course, it has to change. It has to innovate, because the community that we serve now is a digital age community, right? And also as a professional that has been here for a long time, it is the discomfort I put myself in so that I'm able to learn as well. Because back in the day, I was just giving in my analogy, in my story, I was talking about support group sessions, and these were in person. People were coming together for 2 hours to sit in a circle and share information and receive education. So as such, and because communication is so important and human contact is so, you can never take away the importance and the power of human contact. So even with the digitization of information and making information readily available on social media, which is great, because I've seen young people are drawn to other young people. First, it has to be other young people that lead the education. Because I was a young professional back then talking to women and men almost my age. So we have traveled together, and we are now approaching our late 40s. And the message resonated because it was a young professional speaking to another young professional or another same age community member. So the message landed. So empowering young people, capacitating young people to hold their own is key, is important, so that even when they show up in the digital space as educators, they give the correct information, they provide factual information. And the challenge with it, everything comes with its good and bad. The challenge with social media and digital and the world of podcasts is that someone might not have the many minutes we have here talking together, and they may screen a clip that is 2 minutes. A clip is never context. It will never capture the message in context. So people will read, listen according to the mood of where they are in their lives. So we have to always bring it back to and try our best to ensure that at least we still do have those spaces of human contact. Then people can ask real life questions, real time questions rather, and they are able to get the responses to those questions. So the digitization of our lives as it is today is something we cannot avoid. It is also opportunistic and is beautiful and good, because you are able to reach more than the 20 people that are in a room and having a conversation. That important information is easily passed on to millions of people at the same time or whenever people have time. So it is good in that. And I have seen us in the world of development, including governments and local organizations and development partners. We really are trying to fit in and support the digital, the digitization of our lives as it is, to ensure that if there is HIV information that has to be shared on social media, let's find ourselves in those spaces as well. But let's bring data, because that's our strength. Let's bring facts so that there is factual education going. And let's bring this education to young people, because we are zooming in on the population we are most concerned about. And let it be a young Black girl, if we may, because data is showing us that HIV is the epidemic is sitting in the ages of 15 to 24. That is where most transmission is happening. So let's ensure that there is a 17-year-old activist on TikTok who is sharing and spreading information, factual information, but let's also try and ensure where we can that there is human interaction and people come together and
I love that.
So those are the efforts that I've seen. Those are the efforts that I've seen and continue to see. And I know I'm really being very generic in my response, but I just want to lift one initiative for the benefit and the purposes of this conversation, and talk about an initiative called Education Plus. So Education Plus is a joint venture that is co-led by UN agencies, and it's a high-level advocacy intervention. And the agencies that are co-leading the Education Plus initiative are UNICEF, UNAIDS, UNFPA, UN Women, and UNESCO. And it is an initiative that was launched in November 2021 and has been rolling out across Africa, across the world. And the purpose of this, what is the drive behind the initiative, is what I already said, that we have data that is proving continuously that if we keep young girls at school until matric, we are going to successfully reduce their chances of acquiring HIV by 50%. And it is focused on education and empowerment in the sub-Saharan Africa. And it is backed by unstoppable coalitions for change led by adolescent girls and young women. So we really are wanting to resonate on the subject matter with the right population. And we need to deliver proven, multi-sectoral, rights-based interventions to address the vulnerabilities that girls face, including HIV. So it is that kind of an initiative. And just if you bear with me, to emphasize on the need, what Education Plus brings to us for attention is that young girls must have universal access to comprehensive sexuality education, which forms part of SRHR. They must have their sexual health and reproductive health rights. They must have them. In other countries, communities are grappling with the inequalities and the rights that are being taken away from young women and girls. Some other countries are faced with challenges of marrying young kids, taking them into marriage livelihoods, which is not in the best interest of our young girls. Forced sterilization as well. All those things, they bring us to a conversation that have you conversed with this woman, and what are the agreements? What are her rights that have been protected when you forcefully get into a space of forcefully sterilizing a young woman or a woman for that matter? So Education Plus seeks to redress such kinds of wrongs. HIV prevention, education, and efforts, testing and treatment and care if young girls or young women or women test HIV positive. Freedom from gender-based violence, gender-based and sexual violence, because these continue to be the drivers of the epidemic. I know my conversation is really biased towards HIV and AIDS because that's where I come from and that's who I am, but I'm contextualizing it within the conversation of SRHR, because we can't talk about SRHR without acknowledging the drivers of the epidemics that we are faced with, which is gender-based violence and sexual violence. And lastly, we want to capacitate our young women to a place where they transition from matric, high school, which is their high school qualification, to work, not to home, to sit around and not know what to do with their lives. The initiative seeks to bring countries and governments and communities to conversations as early as when they enter grade 8 to say, so how are we going? What matters in the world of this young one as they come into high school? And how do we ensure that they are HIV-free until matric? And once we have successfully done that, how then do we ensure that from matric, they don't go home and idle and not know what to do with their futures? So the school to work transition is not only a mom and dad conversation at home or a conversation when we are hanging out with the girls on the side of the road. It should be a country conversation. Governments, presidents, the whole world should be concerned around what happens to this young one when they complete. What opportunities have we put in already to support their lives moving forward from it? That's what this initiative seeks to achieve. And it is I have personal deep love and appreciation for this initiative because it looks at a young woman holistically. We don't come into a young woman's life to talk about SRHR only. We come in to talk about SRHR and any other subject or concern that keeps her awake at night. because it is those things, when we call it education plus, at the foundations, it's education. But if she has education and the conditions for her success and her thriving in community are not taken care of, that education is not give us or her the outcomes that we wish and hope for.
Yeah. I can hear from your passion and how you speak about this project that it's really close and dear to your heart. And what a wonderful initiative that you've explained. One of the things that you said in this conversation and when you're speaking about this is that young women need to have access to sexual health services, right? But we know that's not the case because of the staggering stats that are really seen. So maybe let's chat to that. What is the most significant barriers that as a young woman they're facing? Let's say if they are 16, 17, and they want to know more about sexual health services, what are some of those things that's stopping them?
It's the lack of education. One, they are not informed. They don't know. No one is talking about it sometimes. So lack of education is at the heart of our challenges. Lack of information also when they are now ready to receive that information. Because we know that there was a time, I'll use South Africa again as an example, there was a time that we had the resources to drive messaging, because messaging is very important. And we could deliver this messaging in 11 languages, official languages. South Africa now has 12 official languages, which include the deaf, the sign language community.
Okay.
So when we could transmit a message in vernacular, because there is nothing as powerful as vernacular. When you transmit a message to me in isiXhosa, which is my home language, I hear you, and I hear you differently. It's different from our young people today because English seems to be a common language that young people use. So even if you fast forward that example I made, that there was a time that we could afford and we had resources to translate messaging across the 11 official languages that we had back then, and people managed to receive this information. Again, it is what you do with the information when you've received it. So if I come to your village and I talk about contraceptives, for an example, and I educate young people on options and contraceptives, and they are interested because now I've capacitated them with information. They walk into a healthcare clinic and they don't find these contraceptives. That is the other challenge that we are faced with. Governments are struggling financially. They are struggling. I don't think there is a government that is intent on not providing support and services to its people. I think there are many, many reasons, and at the heart of it, it is the financial inability to make sure that we put these contraceptives in the hands of the young women. We put these contraceptives, these condoms, we put them in the hands of young men. We educate young men on how to use condoms. Is there a dildo at the clinic to demonstrate how to put on a condom? And also, is there a paid facilitator or counselor who is able to educate on the conditions surrounding the decision to put a condom on? Those are the barriers. And also how much of our culture has changed and how much have we tapped into our behaviors that we want to call culture sometimes, that impedes on our intentions. Because we need to get to that place. We need to talk about habits, because sometimes it's habits. It's not the culture. Sometimes it is the culture. But who is having a culture change conversation at a community level with the elders? At what point are we really going to be comfortable to say, let's come together over juice and peanut butter bread under an oak tree and talk about how much habits, behaviors, and culture and religion impact these efforts respectfully, without judgment. So all of those efforts need financial resourcing. All of those efforts require a level of commitment. And commitment that is also resourced. So these are the impediments, these are the challenges. And lastly is the stigma. So let's say in a perfect world, we have educated a young girl or young man. We've walked into this community, they've embraced us to allow us to have these rich conversations that will improve their lives. We show them statistics and they care about the future and they support our efforts to hold these conversations. And they give us permission to walk into their health facilities and see if these products we spoke of exist. And when they have successfully identified, let's say there is a contraceptive, and the young girl gets this contraceptive. When she walks out, there's stigma. The nurse that administered the contraceptive goes to a church service together with her mom on Thursdays. And then she's going to, without consent, share information that, are you aware that your daughter came to the clinic today to receive contraceptives? So your daughter is now da. You see the stigma?
Yeah.
So stigma is also a big challenge with all of our interventions.
Yeah.
Stigma is big and stigma is challenging. It continues even in the AIDS movement work. It continues, and it takes different shapes and approaches, because back in the day, and the stigma that I make an example of now is external stigma from others. We have also learned in the research work we've done in the AIDS movement, within the South African National AIDS Council work supported by prolific research institutions, that actually there's also internal stigma on conversation with people that are living with HIV. We have also learned that there is a thing called self-stigma. So you stigmatize yourself, probably because of the message you receive externally. So you look in the mirror and you stigmatize yourself. So those are the challenges. The challenges are that it's culture, religion, it's lack of education, and once education has been acquired, the challenge is whether those products are in their facilities or those services are readily available for that community, and stigma. And policy implementation, successful implementation of policy. Because in South Africa, for an example, we are known in the world for having real good policy frameworks. Everybody most countries come to learn from South Africa on how we write such amazing, good policies. Our challenge as a country, which we know, is that it is on the implementation of these good policies that our government has passed, these bills that our government has passed into policy. The implementation of that work is our challenge as a country. In other countries, the challenge is even a step back on the bill, on what is in the bill. What have you written here about young people, and on this supposedly youth policy? Have they been consulted? Are they in agreement? Do they know? Because then when we go out to educate young people on policy, it is on the premise that we want them to be able to hold our governments accountable, respectfully accountable, with facts, with information, to say, this bill was passed into policy for my benefit. And in this bill, it says, if I fall pregnant while I'm at school, I will be supported in this way and that way and that way. And it has not happened. Why has it not happened? That's respectful activism and asking for accountability rather, to leaders, to government. And this is why I'm passionate about education, to say, if we do not then even take a moment to educate a young person on bills that have been passed into policy concerning their livelihoods and their lives, how then do we expect them to know basic information such as 4 kilometers away from your house, there is a youth-friendly clinic that could cater to your sexual and reproductive health rights, which is a big word. And then we have not even educated them on what that means. So we really need to spend time and effort and resources towards educating young people and not making assumptions that just a few that come together on social media are very conversant and highly charged and or knowledgeable on SRHR and its meaning and everything that comes with it. It cannot it has to translate to a young girl in the village who does not have a smartphone, whose challenges include walking 10 kilometers to fetch water to ensure that she goes to the school that we want her to be at. Those are her challenges. Her challenges are not her inability to access a smartphone and be on TikTok. The challenges are she wants to pass her matric. She can stay at school, but her challenges include waking up on a cold winter morning to walk 10 kilometers to fetch water for all of her siblings and is the last to take a bath to get to school. And her challenges include her getting at school after the first period. And she's always put on detention because she gets to school 30 minutes late. So she's looking after her siblings. How do we take care of the siblings as a community to ensure that those are not her challenges? And that is not her concern. Her concern should be getting to school and getting this education. So it's a myriad of challenges, and stigma is at the heart of it.
So many social challenges as well.
Yeah.
I love the points that you mentioned about stigma and even about the policy intervention, because I was going to ask you that, like, has the stigma changed over the many years that we've had sexual health education being taught to us in schools, being taught to us in the movies and the shows that we watch? So it's quite interesting that you're saying that the stigma still persists even at this time. And I think I learned something interesting about what you said about the internal stigma. Sometimes we always think it's the outside, but internal stigma is such a huge and very important thing to talk about. So how do community leaders, this is in relation to what you're saying about policy. I just wanted to say, how do leaders, either at the local community or even higher up in government, really come together to start shaping the sexual health behaviors and maybe give a more positive attitude to these problems that we have that you rightly spoke about?
So we had, I'll give you an example of what we can always try. We should not stop trying. We should always try intervening where we can. We should always put young people, ensure that they are leading conversations about their livelihoods, but not be far away. Let's ensure that they lead and we stand right behind them, because we need to be the cushion and the support so that they are able, eventually, when we decide to step back, they're able to stand. We also have been supported like that in the world of work. So we supported a conversation, parliamentary conversation in 2022, where young girls, school-going girls, had a conversation on SRHR with parliamentarians. I've never seen, it was quite interesting. The dynamics, the non-verbal, the verbal expressions and gestures, and without judgment. We older people are conservative on these subject matters, and that is a fact. So a smart human being, an emotionally smart human being, which is a skill that you learn, by the way, has to understand the room they are walking into so that they are able to customize their messaging, because the intention is to lobby and to receive political support. It's because that was the intention with that particular conversation. So you need to be intent on why you walk into a room.
Yes.
And what you want to achieve. You need to know about that before you walk into that room. So at the point of sitting across this very long table in this intimidating boardroom, with our young ones in their school uniform, very confident young women in the room with the multi-party caucus members of parliament coming in to listen and to add, because the old people don't walk into a room to just listen. They walk in to listen and add. Sometimes they may say what they say after they've listened to you could be progressive and positive and possibly get you to the outcome you had hoped for prior entering the room. But another reality is that you may spend all this time and have this conversation and they still are not convinced. We should not be disheartened when that happens. As long as by the time we leave the conversation, the room is open, the door is still open, we can always come back. Sometimes we don't get the buy-in immediately. Sometimes we don't get the lobbying successfully implemented or orchestrated the first time. So an open door is an opportunity to come back. Let's talk about it some more. Let's talk about it some more. So those are the challenges we've had in engaging, the challenges and possible successes, of course, because that was a beautiful conversation. But I think it was educational for both sides, for both the young people and the parliamentarians, to say, you think when you ensure that there is food on the table and the child gets to school, that's all they should be concerned about. In fact, it is not. You may have driven them to school and you've kept them safe from whatever could have happened on the road. But once they get into the schooling environment, once they socialize with other people, you have to understand you're not the only influence in their lives. So at such a time that other influences come into play, how have you capacitated this young one to be able to face those influences that are not in your control as a parent? And in this example, maybe a conservative parent. Because young children, as I'm talking from a point of view of being a parent, my kids are not the same people at home and at school.
Definitely.
The school gets to experience a different person that I don't know. And I have to believe the teachers when they give me feedback about this person, the person I call my child. Because they are not there is a tone of voice for the schooling environment and with your peers and with your parents. We were those people too. So it shouldn't take us as a surprise. And I don't understand why we get to a place where we are surprised that when we receive certain feedback about our children, because we were those children too.
Yeah.
So those are the dynamics that come into play as we do this work. And engaging with conservative politicians that we love and whom we want to believe have the best interest of us at heart, we always have to understand that we're going to meet at a place where we will have healthy conflicts sometimes, but we should not burn that bridge and never go back to that conversation. We can halt the conversation and come back to it again.
So there's room for more dialogue, more conversation.
Yes, absolutely.
Which is absolutely amazing. So as we're starting to wrap up this conversation, let's start thinking about the next steps. How do we keep on advancing sexual health interventions, in particular for young women? And maybe there's a listener who's involved, and this is something who's listening right now, and this is something that they're really passionate about. How can they get involved and support this really amazing work that many people are involved in doing?
Be curious. Young people we don't even have to preach that they should be curious. They are curious by nature. So be curious about things that affect you directly first. So if after this conversation, be curious about learning on what health policies or policies exist about you. Policies that exist about you that dictate if you should have a clinic close by or argue reasonably why your the clinic that you should access is 20 kilometers away. So be curious about that. Be curious about the departments within government that serve your interest. Get curious, because once you open your mind to that curiosity, it is in that learning that you will lend yourself onto the subject on sexual and reproductive health rights. Understand what this means for yourself. Interpret it. Gather information. Ask questions. When you have done that, in your curiosity, be curious to know who the service providers are. Who are the contracted people? What local non-government organizations exist to look after your needs? And are they doing this work in accordance to what the government has interpreted in a policy document? Learn, go learn. Our young people have to open themselves up to learning. And once you have learned and understood, identify then what your needs are and see where should these needs be accommodated. Do that for yourself. Personalize it first, because you've got to have personal agency. It is going to make you a great human being that will care about others as well. So when you have personal agency, it is easy to get into conversations that are progressive, that will seek to look after your peers as well, especially on similar or familiar themes, context, and needs. So we enter into a space that's humility in a nutshell. You walk in understanding that I don't know, I want to know, but I want to learn the right way. Yes, those clips that are on social media are not the whole conversation.
Yes.
Go and find the rest of the conversation, because a lot is misinterpreted on those clips. And the message is, when we speak about lost in translation, that's what those clips do. Because you lose a spam for young people is quite interestingly conditional. Because if it doesn't show up looking a certain way and is not interesting enough and is not delivered in a certain manner, you have not even, let's not talk about losing a young person in conversation. You didn't even gain them in the first place. So a message to then those that look after the needs of young people on SRHR matters. Let's change with the times too. Let's understand that we are older and we don't understand slang fully. I speak for myself here. We don't understand English that is spoken by young people. It's different to the conventional English that we know. Let's understand that. And when we have, let's get into the world of work, young people that are appealing and are aspiring to other young people. Because if we talk about HIV, we use the example of HIV, and we say the epidemic is sitting between the ages of 15 to 24 among Black young girls. Let's then have, what's wrong with us employing a 23-year-old young nurse, a young Black nurse, to come and service a community in a youth-friendly clinic? Because once young people see people that look like them, they are naturally attracted.
Yeah.
And it could be that this young nurse is a dream of a 14-year-old who will turn 15 and 16 and seek clinical SRHR services and walk into this clinic and finally meet their role model. The challenge we have is that we have not been deliberate and intentional around creating role models for our young people, relevant role models for our young people. We are quick as an older community to judge and throw stones and say, you are choosing people on Instagram that are your role models and you listen to clips. That's not education. But what is the alternative? If they stop Instagram instantly, like you want them to, and not look to those role models on Instagram, and suddenly decide to go and find out on information on SRHR at the clinic, when they walk into that clinic, are they going to find a pink, yellow, blue, green, funky clinic setting with Wi-Fi and a young nurse who has earphones somewhere close by? Is that what they're going to find?
Yeah.
Because those are people that look like them.
Yeah.
If they're sitting at home on Instagram that we judge them on, there is Wi-Fi. It's the comfort of their home. So if we don't want them to be glued to technology and we want them to walk in and we are encouraging human contact, will that human contact be appealing to them? And also has the government and partners innovated that when young people click on social media, click on messaging, do they find apps that speak to who they are at this particular point in their lives? Because remember, young people are not going to be young forever. They're going to grow up. But whom they grow up to be is the foundations are laid in the years that we want to give them education. So they are still going to be different adults needing interventions and innovations that we in my generation are not accustomed nor familiar with. So how much are we really innovating and changing with the times? Because that's where the crux of the matter is as far as empowerment and education and capacity building is concerned. Because we have to capacitate young people to hold their own. They don't have to take batons from nobody. They don't have to be allowed to live by no one. They should lead where they are with what they have.
Amazing. So many wonderful points that you've mentioned. And I hope this can really stimulate some thinking for people and also for young people about how to really go about and being involved, learning, because this is not going to, this type of intervention rather does not just happen by a few people. It requires a whole collaborative effort. And I know I've learned so much in our conversation, and I'm sure our listeners have. So thank you so much for coming on and continue doing this amazing work that you and the partners do at UNAIDS. And I hope that somebody out there, maybe today, may also see you as a visible role model to be like, I also want to be like this lady and how passionate she is about the work that she's doing. So thank you so much for today. I really appreciate you. And to everybody else who's joined in, thank you so much for tuning in. And we'll catch you once again next time. Goodbye.